Soy Christopher Fernández Prada, médico veterinario,
Hello to all of you. I'm Christopher Fernandez Padra. I'm a veterinary physician, professor of parasitology at the University of Montreal. For more than 15 years, I have been researching different neglected tropical diseases with a special emphasis on leishmaniasis and resistance to antiparasitic agents using a One Health approach. It's a pleasure to welcome you to the seminar Inspiring Stories, Testimonies, and Solutions for Neglected Tropical Diseases, with which we commemorate the World Neglected Tropical Diseases Day. This session is organized by PAHO. We are honored to have all of you here today. To ensure that the event is accessible to all, simultaneous translation is available in English, Spanish, Portuguese, and French. To select a language, simply click on the world icon at the bottom of your Zoom window. As we want this to be a participatory activity, do not hesitate to comment or share your opinions in the chat. Here is the order of the day. The seminar will start with a few words of welcome, after which we will present the story of a patient affected by Hansen's disease, who currently chairs the national movement of neglected diseases in Brazil. We will then discuss the importance of a comprehensive health approach to NTD activities, as well as the need to foster partnerships and alliances. We'll then explore the importance of the One Health approach, emphasizing the crucial need for adequate access to water, basic sanitation, and hygiene, as well as intersectoral collaboration for effective control, treatment, and elimination of NTDs. To close the session, we'll share a video showing the successes achieved in the elimination of lymphatic filariasis in Brazil. We'll begin with the words of Dr. Jarbas Barbosa, director of PAHO, on the World Day for Neglected Tropical Diseases. Okay? So I would like to call the government, okay? And so the cooperation organizations and the civil society, because they play an essential role to eliminate these diseases so that the health interventions, they can be implemented mostly centered on people and on our communities. We should place people in the core of our activities and to help them speak up so that we can implement action activities that are sustainable and adjusted to the different contexts, okay? Respecting people's different lifestyles, okay? The neglected tropical diseases, they are more than infections. It is a result of the injustices suffered by our vulnerable populations. These communities that frequently don't have access to clean water, basic sanitation, and high quality healthcare services, they have the risk of contracting these diseases. And then they cannot sometimes work or live properly, and sometimes they die. We need to have a multifaceted approach and implement strategies that encompass surveillance, dissemination of medication, expansion of the vaccinal coverage, improvement of the quality of the water, basic sanitation, control of the vectors, and the greatest awareness and education. Besides that, it is essential for these actions to be intersectoral, okay? And we need to work together, those who work with healthcare, so that we can focus on the One Health. PAHO reinforces its commitment to work with all of our countries so that we can eradicate all of the neglected tropical diseases in the Americas. All of these diseases, they are part of the PAHO's initiative to eradicate these diseases. And we're trying to eradicate over 30 communicable diseases and related diseases within the Americas up until 2030. In the last years, we have been celebrating some meaningful advances, such as the elimination of rabies transmitted by dog in many dogs in countries. And we were able to eradicate the lymphatic filariasis in Brazil, among others. The moment for us to work is now so that we can eradicate all of these diseases. Let's engage the communities because together we can make all the difference and build a more just and healthier future for all of us. And so next we would like to pass the floor to Dr. Silvan Aldiguieri, Director of the Department of Prevention, Control, and Elimination of Communicable Diseases at PAHO. He is going to welcome us. Good morning, good afternoon to everyone. Today we are celebrating the World Neglected Tropical Diseases Day, which affects more than 1 billion people worldwide, with a significant impact in the Americas region, where more than 50 million people require intervention against these diseases. Diseases whose consequences include disability, stigmatization, social exclusion, and discrimination, okay? And all of this generate great suffering and affect their mental health, okay? Or the mental health of those affected, okay? Fortunately, neglected tropical diseases can be prevented, controlled, and in some cases, they can be totally eliminated. These diseases have formal recognition in Target 3.3 of the Sustainable Development Goals, okay? Which sets out a commitment to eradicate them by 2030, okay? Eliminating the NTDs is a key driver for promoting social and economic equity, for empowering communities through improved health and well-being. The Pan American Health Organization, PAHO, and its member states have committed to eliminate more than 30 communicable diseases and related conditions up until 2030, okay? Among these, 12 belong to the group of neglected tropical diseases in the Americas, okay, in our region. And to achieve this goal, the Elimination Initiative proposes a common, integrated, and sustainable approach that fosters cooperation and synergies within the healthcare systems and with other relevant sectors. And as Christopher said,
Dr. Barbosa,
in his word, emphasized a few points, but I'm going to say this again. So far, 11 countries in the region have achieved the elimination of at least one of these diseases. Among the most outstanding achievements is the elimination of onchocerciasis in the next 4 countries, Colombia, Ecuador, Guatemala, and Mexico. In addition to Mexico, in 2017, eliminated trachoma as a public health problem. Mexico also eliminated dog-transmitted human rabies in 2019, making it the first country in the world to eliminate this disease. And it is a pilot country because it's the first time that this is done in the world. To advance in the elimination agenda, it's necessary to promote strategies based on the social and environmental determinants of health, guaranteeing long-term sustainable actions. And in this context, the strengthening of intersectoral actions is also key. We have to consider that the climate changes has a huge impact in many processes, increasing the number of diseases, such as diseases that are vector-borne. The integrated approach to the NTDs makes it possible to offer health care that responds comprehensively to the multiple needs of populations living in remote and hard-to-reach areas. In addition to that, and hard to reach areas is not only a geographic matter, it can be a social matter as well. There are border areas, there are faraway areas, such as the countries in the Amazon basin, okay? And we're also talking about people that live in peripheries that are hard to access due to urban violence. So we always have to think about the concept of lymphatic filariasis. So sometimes they can appear in the international airport and in those regions. So I would like to emphasize the aspects of the One Health and emphasize water, basic sanitation, and hygiene. So in all of this context, I believe that the community participation, okay, centered on people and communities is going to allow us to implement these actions, sustainable actions, to implement sustainable actions with a better participation of these communities, the people affected by NTDs, and also our civil societies. So I truly believe with the elimination strategy in our countries, in the Americas, we have the perfect tool so that we can walk the final mile, walk the last mile to eliminate many of these diseases. And once we achieve these goals, we can see a future. We can see a longer future, we can decrease the load over the community's shoulders, and we can also reduce negative consequences to people's health. So thank you so much for your attention. And above all, I would like to thank the people who are going to speak today during the webinar, even our colleagues that are going to represent their communities and how the communities are seeing their futures, and the vulnerable communities that are not receiving all the aid they need. What we hope to have is a movement inside within the countries and also at the community level, and so that we can have a multi-country movement, okay? We have some areas that we share because of the borders. Sharing successful stories from one place to the other, maybe something that was successful in one country can be also successful in another country. Once again, thank you so much for joining us on this webinar, and I would like to pass the floor to the moderator and to my colleagues from PAHO, okay? And so, thank you very much. Thank you very much, Doctor, for your presentation. That was clear and highly positive, and it gives us all the strength we need to move forward. Thank you very, very much. Now, I would like to call and introduce João Victor Carvalho, who is he was impacted by Hansen's disease, and he's currently the president of the National Movement of Neglected Diseases in Brazil. So we're going to have a moment with him, and we're going to share with him a few questions and answers and how this disease in fact impacted him. I believe João is already here. Good morning, João. Good morning. So I would like to start. Okay, perfect. First, João, could you tell us how you felt when you received your diagnosis of Hansen's disease? Talk a little bit. In your experience, what would have been useful to know in order to cope better with this disease? Good morning to all of you. Outstanding question. I had
E
to
no meu
treat
primeiro
my Hansen's
diagnóstico foi
disease
um
3 times,
momento
and
de
at my first
profundo
diagnosis,
impacto
it was a
emocional.
moment that deeply
Misturou os
impacted me
sentimentos de
emotionally.
medo,
There were
do
mixed feelings of
desconhecido por causa
fear,
da
of the
doença, também com a
unknown regarding the
preocupação
disease,
de como
with my
isso afetaria a
concern
minha
about
vida
how
e
this
as
would
pessoas ao meu
impact my
redor.
life and the
Naquele
people
momento, o que
surrounding
teria
me.
sido
At that
mais
moment,
útil seria ter
what would
acesso
have
a essas
helped me the
informações
most would have been to have
serviços de
access to
qualidade,
information,
de
high quality
profissionais de saúde
services, and caring and
conscientes e
welcoming
acolhedores.
healthcare
Além disso,
professionals. In addition
conhecer
to that,
outras pessoas que
meeting other
superaram
people who
desafios
overcame similar
semelhantes, o que
challenges would have
me
helped
ajudava a
me a
enfrentar o
lot
estigma
and
e a
helped me deal
ansiedade
with
que
the stigma
acompanham o
and
diagnóstico de uma
anxiety that
doença
accompany a
negligenciada.
diagnosis of a neglected
Infelizmente,
disease.
muitas vezes a falta de
Unfortunately, many
informação,
times the
o
lack of
preconceito são
information, the
tão devastadores
prejudice, they are
quanto
so
a própria doença.
devastating as the
Hoje,
disease
trabalho para
itself.
que ninguém passe
Today, I
por
work to
esse
ensure
momento
that no one is
sem
going to go
apoio
through
e
that
orientação.
moment without
É isso.
support and guidance. That's it.
Gracias. En
Thank
tu
you.
opinión, ¿qué
So,
puntos
in your
clave se
opinion,
deberían
what
comunicarse
key
al
points
público en
should be
general para
communicated
ayudar
to the
a
general
reducir el
public to
estigma,
help
la
reduce the
discriminación
stigma
que
and
sufren las personas
discrimination
con enfermedades
experienced by
tropicales
people
con
with
discapacidad?
NTDs?
Bater o estigma e o
Well, fighting
preconceito
against all
é
the stigma and
fundamental para
prejudice is
garantir que as
critical to
pessoas
ensure that
afetadas por
people
doenças
affected by
negligenciadas
neglected
possam
diseases
acessar um
can
tratamento
access
digno
all the
e
needed
o apoio necessário.
treatment, the
O
dignified
estigma não
treatment,
é
and all the
apenas
support.
uma barreira
Stigma
para que
is
as
not
pessoas
only a
buscam
barrier for
ajuda,
people
mas
who are
também
seeking help,
contribui
but
para
also it
sua exclusão
contributes to their
social
social
e a
exclusion and
discriminação,
discrimination,
muitas vezes levando
very
ao
often
isolamento e
leading
à
to their
autodepreciação.
isolation and
Essas doenças
self-devaluation or
têm
self
cura
do
ou
these
o controle em
disease
muitos
have a
casos,
cure,
mas
or can
demandam
they be controlled
atenção
in many
precoce para
cases?
evitar
Yes, but
sequelas
they
que podem
require early
comprometer
attention to avoid
gravemente a
sequelas
vida das pessoas.
that can
O
sequelae
preconceito
that
e
can
a falta de
seriously
informação
compromise people's
perpetuam
lives.
o sofrimento
Prejudice and lack of information
desnecessário e
perpetuate
impedem que as
unnecessary
pessoas
suffering and prevent
vivam
people
com
from living
dignidade.
with
O que
dignity.
precisamos entender
We must
é que as
understand
doenças
that these
que não
diseases
são uma falha
are
individual,
not an
elas
individual
estão
failure.
profundamente
They are
ligadas
deeply
às
linked
condições
to economic and
econômicas,
environmental
ambientais,
conditions,
sociopolítica,
poverty,
pobreza e a desigualdade.
inequality,
Para
okay?
combater o preconceito,
To
é essencial
combat
que
prejudice, it's
promovamos
essential
campanhas que
for us to
reforcem
promote
os direitos
campaigns that
humanos e
reinforce
a
human
dignidade de
rights
cada
and the
indivíduo.
dignity of
Isso é
every single
central para qualquer
person. This is
sociedade que
core to any
aspira a uma
society that
nação
aspires to
justa
be
e também
just and
inclusiva,
also
e
inclusive,
principalmente o
and
empoderamento das
mainly
pessoas,
empowerment of these people.
ouvindo com uma qualidade consciente,
Listening to
a pessoa
them, being
consegue
aware,
desenvolver o
and then people
empoderamento
can
e
develop
aumentar
their
sua
own
dignidade.
empowerment and
A
improve
participação
their
também é
dignity.
abordagem dos direitos humanos.
Participation is also
É isso.
exercising your human
Muchas
rights.
gracias.
Yes, thank you.
Otra pregunta. Como
Another
presidente del
question.
Movimiento
As
Nacional de
the
Enfermedades
president
Psiquiátricas en
of
Brasil,
the
¿qué estrategias
NMND in
se pueden
Brazil,
emplear en
what
estas
strategies
organizaciones
can the civil
de la
society
sociedad civil
organizations
para mejorar la
employ
eficacia de los
to improve
programas
the
contra las enfermedades
effectiveness of
psíquicas
the
desaprendidas?
programs
¿Y por
against
qué es
these
importante
entities?
reforzar
And
su
why is it
participación en
important
el
to
diseño y la
strengthen their
planificación de las
participation in the
actividades relacionadas con
design
estas
and
enfermedades?
planning of the activities related to these diseases?
Muito boa pergunta. E é essencial
Excellent
também.
question, and
As
an
doenças
essential question
tropicais
as well.
negligenciadas
The
ainda
neglected
são um
tropical
grande
diseases, they still
desafio para a saúde
represent a
pública
major
brasileira,
challenge for the
especialmente
Brazilian
em
public
regiões
health
mais
system,
vulneráveis, onde o
especially in
acesso ao
more
saneamento
vulnerable
básico,
regions where
serviços de
access to basic
saúde é
sanitation,
limitado.
health services,
Embora
and
alguns
water
avanços
is
tenham sido
limited.
feitos
Even
nas
though some
últimas décadas,
progress has already
milhões de
been
pessoas no
made in
Brasil
recent
e no mundo
decades, millions of people
ainda
in
sofrem
Brazil
com essas
and in the
enfermidades,
world still
muitas
suffer
vezes
from these
invisíveis
diseases,
e
which are
estigmatizadas.
often
São
invisible and
28
stigmatized.
milhões
We have
brasileiros por
28
ano
million
ameaçados
Brazilians
por
a year
doenças
who
tropicais
are threatened by
negligenciadas.
neglected tropical
Observamos que
diseases. We
vermes,
observe that invisible
protozoários,
parasite,
bactérias
protozoa,
são
and
invisíveis e
bacteria,
ameaçam a
they
saúde de uma
threaten
boa
the health
parte
of a
da
large,
população.
large part
O
of our
nosso movimento é
population.
composto
Our
por
movement
lideranças e
is
pessoas
formed by
afetadas por
leaders
doenças
and
como
people
Chagas,
affected by
leishmaniose,
diseases such as
hanseníase,
Chagas disease,
tuberculose,
leishmaniasis,
hepatite,
Hansen's
filariose,
disease, tuberculosis,
esquistocinose, as
hepatitis,
doenças parasitárias,
filariasis.
parvoviroses.
Okay,
Trabalhamos para
and we
amplificar
work to
as
amplify
vozes
the
desses
voices,
pacientes para
pardon
poder
me, of these
auxiliar na
patients,
formulação
and
de
thus
políticas
to
públicas,
help people
principalmente por
create
meio de
public
campanhas
policies,
de
mainly through
sensibilização,
awareness
participação em
campaigns,
fóruns,
participation in
articulações com o poder
forums,
público.
coordination
Exemplo
with the public
recente foi a
authorities.
nossa
A
atuação
recent
junto ao
example was
Comitê
our work
Interministerial,
jointly with the
que é o Brasil
Interministerial
Saudável.
Committee,
Buscamos
which is
garantir que as
called A Healthy
necessidades da
Brazil.
população
We
vulnerável
seek to
sejam
ensure that the
consideradas na
needs of
formulação
the
de
vulnerable
políticas
population in
públicas.
Brazil are considered
Atuamos
in the
também no
creation of our public
monitoramento, na
policies. We
cobrança por
also monitor
melhorias
and
em
demand
serviços
improvements in
como o saneamento
services such as
básico,
basic
porque é
sanitation,
fundamental
drinking
para a
water.
prevenção
These are
dessas
essential
doenças
to
e
prevent these
principalmente
diseases,
para a
and
gente
mainly
poder
to
empoderar
empower
e dizer a
and
nossa
to
realidade.
express
Todos
our
nós que
realities,
passamos por
because
esses
those of us
problemas do
who
Sistema
face these
Único de
problems
Saúde
in the
entendemos
unified
e
healthcare
conseguimos
system in Brazil, we
identificar uma maneira
understand
mais
and we are able to
eficaz para
identify
se
a more
comunicar,
effective way of
traduzindo uma linguagem mais
communicating.
acessível para
We
as
translate
pessoas.
everything into a
Lembrando
language
que
that
na
is more
gestão
accessible
pública
and easier
existe
for
muitas
people.
pessoas e o nosso
Remembering that there
trabalho
are
é
many
influenciar
people
nas
in
ideias
the
das
government,
pessoas. Não
and
temos
our
o
job is
poder
to influence people's
executivo e
ideas.
poder
We do not
executar
have the
políticas.
executive
Não temos o
power or
poder
legislative
legislativo
power
de
to
poder
do
criar
that.
leis. Não
We
somos
cannot create
políticos.
laws.
Nós
We are not
conseguimos fazer
politicians.
leis através da influência,
We can create
participando
laws
na
via
cultura
our
social,
influence, taking
influenciando nas
part
regras,
through social
principalmente com o
control,
executivo e a amizade.
influencing people's
Esse é o nosso
ideas, and mainly
poder. E
by
só
creating
assim a gente
friendships. This is
consegue
the power that
combater
we
ou
have.
diminuir
And
as
that's the only
determinantes
way we can
sociais,
act
ou até
and
mesmo
reduce
eliminar
social
os vírus, as
determinants, and
bactérias e os
even eliminate
protozoários.
the viruses,
Nós, a
bacteria, and
comunidade,
protozoa.
acredita
We, the
nesse
community,
movimento
we
todo de
believe in
pessoas
this movement of
sensibilizadas para poder
people,
resolver
okay?
um grande
Raising
conflito
awareness so
social.
that we
O
can solve a
movimento, ele
huge social problem.
acredita e também
This
acredita
movement
toda a força
believes
do querer
and
e a
gives
nossa
all the
vontade
strength
para a
and
gente
the will,
conseguir
and so
resolver
that
essas
we
questões
can
sociais.
overcome these
O homem
social
tudo pode,
issues.
só basta
So
querer e
a
vontade. É isso.
men and women can do anything. All they need is
Muchísimas
will.
gracias
That's it.
por
Thank
esta
you very
respuesta. No
much.
podría estar más de
Thank you
acuerdo.
very much.
Y a
Okay.
continuación le
And
invito al señor
now,
Carvalho a
now
compartir
I
un
would
poema
like to
que ha
invite
escrito
Mr.
usted
Carvalho
sobre
to
las
share a
enfermedades tropicales
poem
desatendidas.
he has
Y cuando
written
quiera.
about entities. Okay.
Tá bom. Uma expressão artística
Okay.
é muito importante
An
também
artistic
no
expression of
ativismo.
our feelings is also very
São
important in the
as
work we do.
doenças
The
negligenciadas,
neglected
aquelas que
diseases,
são tão
those so
faladas.
often
Eu vejo
mentioned.
poucos que fazem alguma
It's a
coisa,
neglected
mas muitos
diseases,
que não
those
fazem
so
nada.
often
Mas
mentioned. I
mesmo
see
assim,
few who
os
do
poucos que
anything.
fazem
Many do
fazem uma
nothing, but
diferença
still the few
danada.
that do
Dá
something make an
trabalho,
immense
faz
difference.
parte da
It's hard
escalada.
work. It's
É o
part of our
aprimoramento.
climbing.
Abrimos a
It's
fronteira,
improvement.
estamos
We open
passando,
up
mas
frontiers
ninguém
and
na
borders.
dianteira.
We're moving
Do
forward, but
lado,
no one
unindo
leads from the
forças e
side,
chamando para
joining
remar no mesmo
forces and
barco.
calling out to row
A
on the same
hanseníase
boat.
é esquisita. Passa
Hansen's
por
disease is
problemas, é
strange.
algo que
It goes
limita,
through problems. It's
mas não
something that limits
impossibilita.
us, but
Damos
it
de
doesn't make
cara
it
com essa doença
impossible. We
esquisita.
face this
Junto com
strange
ela, tem
disease.
as suas
Along with
amigas.
it and
A
its friends,
tuberculose é algo que
tuberculosis
intriga,
is something
que também é amiga
intriguing,
da
which
doença
is also
esquisita.
a friend
Estão
of the
sempre
strange
juntas.
disease. They
Uma
are
passa
always
fome e
together.
a outra se
One
mascara
feels
pelas
hungry and
ruas.
the other disguises
Visível
itself through the
apenas para
streets,
aqueles que estão na
visible
luta,
only to
pelas
those who
suas
are in the struggle
sobrevivência.
for their
Mas a vida
survival. But
continua.
life continues
Invisível é a prima
invisible.
da
Oh,
esquisita e da
continues.
intrigante,
Invisible is the
Dona
cousin
Chagas,
of the
que vive
strange
por
and the
aí se
intriguing,
aproveitando do
Madame
conforto que o
Chagas
pessoal oferece.
disease, who
A
walks around taking advantage of the comfort that people offer to the Mr. Insect between mud and adobe. He is the host. But what kind of hotel is this that is abandoned? It needs good housing and basic sanitation. Fortunately for the disgruntled, the family just grows. Madame Filariasis, who only understands pain, the one that people suffer. The mosquito does not even flinch. If there is garbage, sewers, it's a paradise for it. It calls all of its friends, Brother Leishmaniasis and his gang of hungry dogs. It seems almost like a parallel universe, but the diseases speak for themselves. The scenario, vulnerability, is a well-visible face. Vanity, not seeing the indivisible and thinking that everything flows naturally. We need more visibility. We need more visibility. We are not the disease. We are people who are facing situations at moments that are very difficult and very unhappy in our lives. But we were able to overcome this and overcome these problems, and mainly to help people and also to share these discussions and debates at the municipal level, at the state level, at the national level, and at the global level. We would like to thank you for the invitation. Thank you for the opportunity to participate. And I would like to invite all of you to get to know our movement. Our website is www and Movimento. Thank you very much, Mr. Carvalho. Thank you so much for sharing this experience with all of you. And I would like to invite all of you to understand the movement a little better, okay? Now, so it's important for us to have an integrated program, because many communities affected by these diseases, they find themselves in remote areas where access to healthcare services is limited or non-existent. It is therefore essential to reach these communities with the necessary resources to provide comprehensive healthcare to them, and not only that not only addresses the specific needs of these diseases, but also contributes to the strengthening of local healthcare systems and improving the overall quality of life. The initiative to eliminate more than 30 diseases and related factors promoted by PAHO recommends integrated interventions focused on primary healthcare for populations in vulnerable conditions, with an approach based on equity, gender, and cultural diversity throughout the life course. Trachoma is part of this initiative, and its activities can become a platform for addressing other diseases and relevance to communities, including both neglected tropical diseases and other priority health conditions.
With the attention centered on people and their needs. As an example, we'll watch a video showing the integrated projects in Ecuador, Colombia, and Venezuela as part of the dissemination of the disease.
Nosotros estamos obligados a
We are
interactuar con
obliged to interact with an intercultural perspective and to adjust our actions to how populations understand them and how they practice them.
Caso muy especial de tracoma
A
ocular.
very special case is ocular trachoma. Ocular trachoma has been a prevalent disease in the department. It was described in 2010 due to a finding we made and an article we published which made it visible for Colombia. But in reality, ocular trachoma has been prevalent, causing blindness in many people and leading to premature deaths in many individuals. Here, before people die of blindness, they die from other causes. They die from a snake bite accident, an accident because they cannot access food, or because they cannot travel and contribute to the family economy. We are carrying out campaigns to operate on patients from trichomatosis. Trichomatosis is a disease that usually occurs in communities located in remote areas with limited access to sanitation and significant challenges in obtaining timely medical care. This makes it extremely important to find these patients in time and treat them to prevent vision loss. Vision is important to everyone, but in these communities, it's even more critical because they live in very remote areas where their primary daily task is to find food. If these patients cannot see, they cannot secure food for themselves or their families, often leading to extremely difficult living conditions. How do you feel after the surgery you had today? Would you advise other indigenous people to undergo the procedure? I feel good. I want to encourage other patients who have this symptom, this eye problem, especially trichiasis, to seek help. I want to advise other vision problems to come, get evaluated, and undergo the procedure. Seeking this help is very important, and I really emphasize on the need to undergo the procedures. PAHO actively works with the Ministry of Health to assess the situation of communities, identify priorities, develop programs and interventions, and coordinate with other partners from the United Nations system and financial counterparts present in the country to secure funding and implement more integrated interventions. In addition to infectious disease care, other interventions are carried out to address health priorities. This includes maternal and child health care, as well as diseases related to communicable illness affecting the population. Immunization efforts are also part of the initiatives, ensuring that through the opportunity to reach these areas, children's vaccinations coverage can be updated along with other priority health interventions based on assessments by health authorities. Within the framework of the roadmap for the elimination of neglected infectious diseases, it is important to highlight that the Ministry of Health aims to understand the situation of trachoma in prioritized cantons. This enables us to coordinate further actions to improve the health of the Ecuadorian population. The Ministry of Public Health coordinates locally with the National Directorate of Intercultural Health. Through intercultural health monitors present in the communities, we establish a connection with epidemiologists from the National Directorate of Epidemiological Service and Surveillance, facilitating preliminary approaches that allow access for healthcare team traveling to these remote areas. PAHO's support has undoubtedly been a key pillar in reaching these remote communities, given our own significant access limitations. However, actions strengthen all these strategies, not only for the elimination of trachoma, but also for the eradication of other neglected infectious diseases.
Thank
you for coming. It's very important for us to have you here. I appreciate your arrival in Limonconcha and your investigation of the disease, which we are unaware of. Thank you.
Damos ahora la
We
bienvenida a la
welcome now Dr. Olga Aldama, specialist in clinical dermatology, surgical anesthetic for adults and children of the Health Ministry, Public Ministry, and Well-being, Social Well-being of Paraguay. Dr. Aldama will share her reflections on the importance of creating associations and alliances to improve the integrated activities against ETDs. Good morning to everyone. It's a pleasure to share with you this moment here, Christopher. from Paraguay. We are very happy to be able to share a little bit of our work and tell you a little bit about this idea that was born in 2016. The project is called Pide por Arvikayal from the Guarani idiom language. It means a search for a health skin, and it was born in the 2016 from the Paraguayan Society of Dermatology, presenting this national control program, and we begin working and adding collaborators to this project. Yes, please. No, I'm sorry to interrupt, but I was going to ask you if you could explain to us a little bit about the coordination process of these activities with different collaborators, and which were the main challenges and opportunities that you found, and why is it crucial to work with collaboration in this context? Well, we as main objectives had the aim to get to vulnerable and isolated populations with little or no possibility to exceed the attention of a specialist. You need to take into consideration that in our country, we have many diseases that are neglected in terms of cancer, skin cancer, and other skin diseases. And we are working with all these neglected diseases, and we are trying to have the most integral call possible to the patient. And we had the inclusion of dermatologic surgery in this process. Another important pillar to this project was to capacitate the personnel of this area and allow this capacity to be installed and their contacts to be within reach so that we can respond as fast as possible. To get collaborators is a difficult task. It is to present the idea and to make them understand the importance of the project for the population. So we work with hospitals, school hospitals, with postgrad in dermatology, scientific associations of dermatology, microbiology, and biochemistry, as well as hospitals in the public sector in the areas where we are working. And what we do here is that we cover all the part of the human resources. But what is the challenge here? Is to find out what's the logistic cost. And that's when we began adapting or knocking on the doors of pharmaceutical companies, NGOs, and binational entities such as OPS or OMS, the Health Organization, International Organization, World Health Organization, I'm sorry. And every year it became more visible. And in the last few years, we integrated to the work other programs of the health ministry, such as the National Program for Tuberculosis, for AIDS, and vaccination. Besides the collaboration of a scientific international society, which is the Latin American College of Dermatology. The idea that we've established that for us is that it will continue to be a challenge to make it happen every year. We have the will, we see the results, and that motivates us a lot. And that tells us a little bit about what we did in this last year with the Pide por Arvikayal. We've attended more than 1,000 patients with dermatologic surgeries, and it was really integrated work, grandiose work that we were able to finish and accomplish very successfully. Okay, if you don't mind, we will watch the video on the continuation here, where these diseases, neglected diseases of skin are presented, and I wanted to highlight that this is a project that counts with the support of Paraguay institutions, the dermatology of the University of Medicine of Pilar. It's a great group of work, so let's look at the video.
Hemos concluido la atención dermatológica
to finish our call for the city of Pilar with a very successful journey in terms of dermatology. We made many surgery procedures with neglected tropical diseases. We have leishmaniasis, subcutaneous leishmaniasis, and various other pathologies as well. We are collaborating in a solidarity effort to provide assistance, education, and healthcare in an area with limited access to dermatological services. I believe this specific action enables multidisciplinary work and allow us to share this experience with other areas that may need it or that also need collaboration to improve the overall quality of health for everyone. It is an initiative that cannot be wasted and must be strengthened for the well-being for our patients. It is extremely important for early diagnosis, timely treatment, and obviously for promotion and prevention. The Pan American Health Organization, under the Elimination Initiative and the WHO roadmap, has been working with skin-related neglected diseases, as well as other ectoparasitosis, with an integrated approach that can offer opportunities for detection of multiple conditions, as for example, a single intervention. And then we can optimize resources and, most importantly, improve the quality of life of affected patients. If we find a melanoma, it will have been worth it. If we find a case of leprosy, it will have been worth it. I believe that this is a beautiful experience because we are doing the treatment, medication for the patients, and I think that even if we cannot resolve all the things, the majority will be dealt with. I hope that the organization can be more present here. The service was very good, very quick. It was great and very, very fast.
Muchísimas gracias, doctor Aldama, por compartir esta valiosa experiencia.
Dr. Aldama, for sharing these valuable experiences from Paraguay. It was very enriching with all the situations and the alliances and the results. Thank you very much. Thank you.
Ahora vamos a invitar al doctor Omar
Now
Flores
we
Velasco,
are going to invite Dr. Omar Flores Velasco, professional of the monitoring of leishmaniasis in the National Program of Diseases Transmitted Vector-Borne, about the tropical neglected diseases, and General Director of the Epidemiology of the Health Ministry. Good morning. As was said here, I'm Mr. Omar Flores Velasco, professional of monitoring of leishmaniasis in the National Program of Diseases Transmitted Vector-Borne, as well as General Director of the Epidemiology of the Health Ministry and Sports, and in charge of the Ministry of Health and Sports. In the year 2021, the Ministry of Health in Bolivia detected a growth of leishmaniasis, visceral leishmaniasis in the municipality of Villamontes, Tarija, and in the coordination with the PAHO, was implemented actions in the control and vigilance. In this experience and activities implemented, we have considered the focus on One Health, in promoting the coordination and collaboration for the programs of health, human health, animal, and environmental with the purpose of improving the prevention and the preparation facing future threats of health. The activities that were implemented are listed in the political, health, communitary, intercultural, the SAFCI, and their principles are the participation in the community with the capacity of the urban communities and rural communities, indigenous region areas, intercultural and Afro-Bolivians of participating directly in the decision-making, the intersectionality that allows intervention coordinating within the communities of urban and rural with the different sectors in basis of alliances strategically wise with the purpose of acting on the determinations such as education, water, environment, culture, living, social organization, and others in the mark of co-responsibility, the interculturality and the articulation, complementarity and reciprocity based in the acceptation, recognizing and valuing the both acknowledgement and health practices that are seen in indigenous peoples, Afro-Bolivians, and intercultural communities. The integrality allows health as a totality to contemplate the person and its relation with the family, the community, the environment, and the spiritual world. I would also like to emphasize that besides the activities, specific activities of control of the disease, we also implemented the following activities for human health: the dotation of medications for treatment specifically for leishmaniasis, visceral leishmaniasis, and trials of diagnosis of quick RK39 for the detection of human cases, activities of communication, education, and information in the population, as well as communicational messages to infiltrate in the conductual change of the population, as it refers to managing proper management of waste and understanding the symptoms of sicknesses, supervision of strategic and adequate nutritional state of feeding complementary food to the kids, as well as strengthening through establishing health and the consumption of micronutrients. Number two, for the environmental component, it's been taking place campaigns of cleaning, massive cleaning of organic waste, and where it has been organized multidisciplinary brigades made by municipal personnel, regional government, ministerial, and joints of neighbors and military personnel, implementation of strategies of vectorial control as well, and for the animal salute, been realizing surveys, serologicals, and the type of work that has the focus on collaboration and participation of society is key. So let's look at a video about the focus on health.
Villamontes, ciudad ubicada al sur de Bolivia, dentro del departamento de Tarija,
in the south of Bolivia, within the department of Tarija, autonomous region of the Chaco River, on the slopes of the Aguaragüe mountain. It is located at 238 meters above sea level on the left side of Pucomayo River. This municipality was the setting of a joint mission between the Ministries of Health of Bolivia and Brazil, together with experts from the Pan American Health Organization, PAHO, to control the outbreak and prevention of new cases of visceral leishmaniasis. Since the end of 2021-22 management, cases of visceral leishmaniasis were reported in the municipality of Villamontes, Tarija. At this moment, the place constitutes as an outbreak of concern. This mission applied an innovative strategy for the control of the outbreak of visceral leishmaniasis with the implementation and training of the placement of collars impregnated with insecticides in dogs, as well as strengthening the local capacity for diagnosis and sampling of dogs. I know perfectly well that one of the main responsibilities of my work is precisely to put 100% of my effort. And I want you to know that all health personnel and those who are needed will always be available because we are the most interested in this being eradicated quickly. The municipality of Villamontes is in the midst of an outbreak of visceral leishmaniasis, which is a serious disease, and when left untreated, 90% of patients can progress to death. There are different actions that are being carried out, such as vector and reservoir control, environmental health, and timely attention to patients. And this week, what we are doing with the control of reservoirs is the implementation of collars to all dogs. There are more than 14,000 collars that have been managed by the Ministry of Health in cooperation with PAHO. It is important to inform that the group is a large group, around 120 people, who were divided into brigades, who today are cleaning those places affected by leishmaniasis, doing a general sanitation of this entire area, trying to identify house by house, visiting families, identifying house by house, carrying out the control, both in the part of health as well as people and animals. Screening of the dogs is being carried out, sampling and the placement of collars that act as a repellent for the leishmaniasis vector. For the first time in Bolivia, these collars are being used. We believe that with these actions that are being taken, we will stop the transmission of leishmaniasis as soon as possible. The campaign is very good, and we'll be able to know if the dog's sick or not, to walk calmly in the street. And we want to thank the authorities for what they have done, the Commission of Brazil for doing the analysis of the dogs to see if they are sick or not. It is a relief to walk through the streets and see the dogs with their collars and not have much fear and walk calmly.
Muchísimas gracias, Dr. Flores Velasco, por compartir.
Thank you very much, Dr. Flores Velasco, for sharing your experience on this focus on health within the tropical neglected diseases. Thank you very much. As a last subject today, we would like to show a video with the successful Brazil on filariasis, and we want to congratulate Brazil. It's the country number 57th of eliminating a disease such as this one. So we'll show you the video now.
After decades of integrated efforts and multilaterals, emphatic filariasis has been not a problem of health issue in Brazil. The eradicating disease certification was delivered by the PAHO's regional office director Jarbas Barbora to the health minister Lydia Trindade. The ceremony happened in the mark of the meeting of the PAHO in the United States with the presence of health authorities of all countries of Americas. Lymphatic filariasis, better known as lymphangiasis, is a parasite disease transmitted by mosquitoes. It affects the lymphatic system and may cause serious swelling, especially in the inferior members and in the genitalia, causing a lot of pain and may cause permanent deficiency. To fight this disease, the Ministry of Health of Brazil launched in 1997 a national plan for the elimination of filariasis. From that point on, many measurements were implemented, such as the mass distribution of antiparasitary medications, vector control, and constant monitoring in the most affected areas. These efforts were concentrated in the areas where filariasis was endemic and resulted 10 years later in the end of the transmission of the disease. Since 2017, there were no more cases confirmed of filariasis in Brazil. The elimination of this disease, the eradication, is the result of the work together of health employees, researchers, managers, as well as the creation of a universal health system with actions of surveillance that are well structured, as well as a network of public labs specialized in the launching of health program of Brazil. And it's a multi-sector action aligned with the initiative regional of PAHOs for the elimination of the diseases up until 2030. With this certification, Brazil demonstrates its strong commitment to the protection of health, and especially to the populations that are most vulnerable. Congratulations, Brazil. And now to finish the session, I would like to invite Dr. Ana Lucianes, a doctor for the regional aid for the tropical neglected diseases of PAHO. Good afternoon to everyone. In the name of the program of neglected tropical diseases, I want to thank everyone for their valuable contribution, and I want to invite to continue assisting this moment today. I want to thank the support of Canada government and other supports, the End Fund as well, Tropical Data, sponsors of these activities, and a sincere thanks to the health minister and all workers that work in sanitations, as well as partners of PAHO in the countries around the world, and all our partners in this very important activity. We wish you a very good day. And since we're finishing a little bit earlier, thank you very much for being here.